We date back to 1932, which predates the National Health Service, which, as you know, started in about 1948, and also our sister organisation, the Royal College of Anaesthetists, which we started in 1948. There really hasn't been a significant development in anaesthesia or perioperative care in the United Kingdom and Republic of Ireland that we have not been involved in the last 82 years. I suppose if you asked me what our core concerns and core activities were, I would say straight to you, they are safety, they are education, and they are research. Now, you would expect a professional representative organisation like the AAGBI to be primarily concerned with its members, with the doctors, but we absolutely do not put our doctors, our members first. We put our patients first every single time, because we strongly believe that an organisation that supports and protects the safety and treatment of its patients, keeps its patients well, is also in the interests of its members. Fit, healthy and safe patients mean fit, healthy and safe anaesthetists. Inevitably, a speciality like anaesthesia, which has a direct patient interface and involves instrumentation of patients, has got a very important role to play in infection control. If we don't obey current best practice rules and guidelines in making sure that what we do to patients carries a minimal risk of infection, we can put our patients significantly at risk. Do you know, not long ago, I stopped at the side of a road at the scene of an accident, and I was a first responder at the accident. And I walked in, and the patient looked quite injured. And I looked around me, and I suddenly realised there was very little I could do, because I didn't have any equipment. And it really made me understand that anaesthetists, without the equipment that they use to treat patients, are nothing more than first aiders in that respect. We need that equipment to provide the specialised care that we provide to patients. Now, I'm really proud to say that the association, throughout its long history, has had a fantastic relationship with the industry. It is mostly, or at least in part, through BAREMA, which is the British Anaesthetic and Respiratory Equipment Manufacturers Association. We have regular meetings with them and regular meetings with their industry members. Now, if I could take a good example of one of the industry partners with whom we work, I perhaps could pick Pentland Medical. Now, we have known them for many years. They are good in supporting us and supporting our major meetings, WSM in London every January, and our annual Congress in September, which moves around the country. We know them, we know their products, we know the people involved. So if any of our members come to us and say, look, we've had a problem with a product, or we'd like to give some feedback or a product, or we've got a great new idea about a product, we can take that idea straight back to the industry, and we can start to get them working on any corrections, any improvements, or any new equipment. Now, obviously, monitoring is absolutely key to what we as anaesthetists do. It forms the very core of our safe management of patients. And I'm particularly excited that Pentland Medical has got a new piece of monitoring equipment which will give us 3 continuous different modalities from a tiny little clip placed on a patient's nose. It's going to give me heart rate, it's going to give me oxygen saturation, and believe it or not, it's going to give me respiratory rate. Now, they've starting to produce that equipment, but it's absolutely vital for the ongoing development of that equipment that when we as anaesthetists use that equipment, we feed back to them our views about it so that they can then feed that back into the development process.